afternoon, everyone. As you all come in, just want to greet you and we will get started in just a moment. Let a couple more folks inside and we'll get started. All right, so we will go ahead and get started. I do want to say good afternoon to all of you. My name is Lauren Jones. I use she, her pronouns, and I serve as the Director of Diversity, Equity, and Inclusion here at the School of Public Health. I want to first acknowledge that my home and the office that I do occasionally work in at the University of Minnesota Twin Cities is built on the traditional homelands of the Dakota people. We do want to acknowledge that the land was stolen and unceded, and we are hoping to work with the Dakota people and other indigenous tribes in this area to make sure that we pay a proper tribute. And I do support the land back movement. Secondly, I want to point out that closed captioning is available for this program. You can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who is providing our technical support today via the chat to ask questions about accessibility. And we'll monitor the chat for questions, as well as share links to our evaluation and information about future events. So the Justice and Public Health series was started last year as part of the School of Public Health's commitment to justice and anti-racism. We have been hosting monthly events with local and national experts around topics of public health. Our speakers and presentations in the series help to ground us both in theory and in practice, as well as complement the classroom learning that our students are going through. We hope that today's discussion is part of a broader change happening outside SPH as well as inside the school. If you're interested in staying abreast of our Justice and Public Health events, please be sure to fill out the event evaluation after this and check the box to receive notifications about upcoming events. You can also check our website at any time, and we are recording this event and it will be available on our YouTube and our website for at least 180 days. Now I'm going to welcome our speaker for today. Don Hunter, JD, MPH, is the Network for Public Health Law's Southeastern Region Director. Don is an experienced State Health Department policymaker and legislative director whose work focuses on research, analysis, implementation, and capacity building related to the use of law and policy to improve health outcomes and advance racial equity. She previously served as Deputy State Health Official in New Mexico, where she led legislative planning and policy development, strategic planning, performance management, and public health accreditation. Dawn started her career in Child Protective Services in Hillsborough County, Florida. She later transitioned into research and development as a microbiologist at the University of South Florida Center for Biological Defense, with a focus on rapid detection methods for food and waterborne pathogens. Dawn is certified in public health by the National Board of Public Health Examiners. She received her AB in English Literature from Princeton, her BS in microbiology, and her MPH in global communicable disease from the University of South Florida, and her JD from Stetson University College of Law. Please help me welcome Dawn Hunter.
Thank you, Lauren, for the introduction, and thanks to the School of Public Health, Lauren, Andrea, Charles, and Sarah for the opportunity to be here today. I'm really excited to get to share some of my work with you, and I really hope to leave you with an understanding of the relationship between voting and health and the importance of taking action. So I'm going to share my screen. Feel free to put messages into the chat if it's relevant while I'm talking. I will try to answer it while we're going, and otherwise I will just scan them as we go along. So again, thanks for the opportunity to be here today, and let's get started. So first, I want to tell you about the Network for Public Health Law. We are a national organization that provides legal technical assistance in the form of consulting, training, resources to local, state, and national health agencies and organizations, and a wide variety of public health partners across the United States. We do consultation, as I mentioned. We also do a lot of training and workshops. And importantly, we spend a lot of time doing research and analysis of law and policy on pretty much any question you can think of. And if we don't have the answer, we know someone who does. So we also like to connect people. Some of the top areas for legal technical assistance we get, which is really questions on law and policy, are the lists that you see here. So if you ever are in need of assistance, I have gotten requests from students and researchers before. These are some of the areas that we get the most requests in, but we get requests on any topic. But that includes COVID-19 emergency legal response and other emergency legal response issues. Substance use and harm reduction and health information data sharing are our top 3 areas. And of course, statutes and regulatory information are incredibly important in the world of public health, which in my opinion turns on administrative law, although heavily influenced by case law during the pandemic. So my objectives today are these. I hope to explain policymaking in public health, even if it's something that you know. I like to remind folks of what you can do to influence policy and how. I want to describe current legislative trends in health and racial equity. Having been a legislative director and in my current role, I still get to do legislative analysis. And so I'm going to share some of that work with you. I also hope that you leave with an understanding of current developments in addressing racism as a public health crisis. I probably spend the bulk of my time on this particular work. I hope that you leave being able to explain the relationship between voting, health outcomes, and health equity. And finally, that you can connect civic engagement to current public health practice. But first, a reminder, it is officially 20 days to midterms. That's actually also why I'm really excited here to share the work that I've been doing, because it really does have an impact on voting and civic engagement. And I want to encourage you to think about the importance of voting from a health and racial equity perspective. And I might remind you a couple more times, midterms are coming up. Early voting is going on in the state of Minnesota and in many states across the US. Now is the time to act. So let's start with policy making and why it's important. First, it is associated with key public health accreditation standards. So if you work in a health department, these are the standards that we aspire to meet to show that we are doing the job of public health. It is also a core public health function. And importantly, it's a tool to improve individual, family, and community health. Having been a legislative director, policy development looks like a lot of different things. It might be proposing legislation, analyzing it, providing technical advice, and testifying on a bill, implementing a statute once it's signed into law, monitoring the impact over time. And on the right-hand side is an image that has some terms that you might associate with policymaking or policy development, like public health leadership, governance, assessment, assurance, mobilize, change, impact. These are all things that I think of, and in groups that I worked with think of to help create this word cloud of what is policymaking in public health. But first, a question that I would ask for you to think about is, do you know when your state's legislative session starts? I'm not sure that I can see, oh wait, I might be able to. If I can see the chat, do you know when your state, so you can give me Minnesota, and if of course you live somewhere else, is your permanent residence, you can share that. But in the chat, share if you know when your state's legislative session starts for 2023. I'll give you a clue. It is nobody's starting before the end of the year, but lots of states are starting in January. So the answer for Minnesota is January 3rd, 2023. This is per Minnesota statute 3.011, the first Tuesday after the first Monday in January, which this coming year is January 3rd. So it's actually really important to understand and know when state legislative sessions are starting. One, in your own state, because you want to be involved in the policymaking process, but two, so you can monitor and track what's going on in other states. We know that none of this happens in isolation, and what happens in one state can often be adopted and adapted in another state. And so this is a resource from the National Conference of State Legislatures. This is current through today. And this is a map of the current status of legislative sessions across the country. So in orange, these are legislatures that have adjourned. In green are legislatures that are currently still in session, and those that have an asterisk have year-round legislative activity. This is going to change once January rolls around. January and February are when most state legislatures that are not all year pick back up. So I'm going to go over really quickly an overview of the legislative process. Again, even if it's something that you're incredibly familiar with, it's a good, I think, lesson to remind you of like where you can have impact. So in general, in a bicameral legislature, and the specifics will differ across states, but in general, it looks like this. That is, a bill gets introduced, it goes through some smaller committee hearings where it gets debated, it gets amended, members of the public can come and give comment, experts, there's lobbyists in the hallway. This is where kind of the meat and potatoes of the work of crafting these bills comes through. The committee issues a report, eventually it goes to the floor of the first house for a debate, and then it gets voted on, and then that entire process gets repeated in the second house. And then depending on if the bills that get passed are significantly different, it will go through some sort of concurrence process or concurrence committee before it gets sent to the governor for action. Each point in this process is an opportunity for you to have an impact. I want you to think about that as we go through the presentation about how you can make a difference. One, you can contact your legislators or the governor's office at any point in time and share your opinions on what's going through the legislature. You can give public comment during committee hearings, and also, as a reminder, during any public hearing in your community, whether that's city council or county commission or school board, you can go make your voice heard. You can educate community members and clients and partners and friends and family on pending legislation and policy issues in your community. You may be in a position at an organization where you're analyzing bills. And importantly, for all of us, is you can share an idea for a new law or policy. That's my little guy in orange up here on the left, which is really saying like, this is how bills come into being. Somebody in the community contacts their legislator and says, hey, I have this idea. Can you help me bring it to life? And that's how a lot of bills come into being. But it's also how policy in general, even at the local level, comes into being. Someone has an idea. So how can legislation help or hinder efforts to advance health equity? Well, one of the things that I do is explore health and racial equity legislative trends. So what you see here is combined for 2021 and 2022. And I want to thank my summer law clerk, Haley Campbell Garcia from the University of Kentucky Law, who helped to do this research and put this together. But basically what you can see from this map here is that everybody is interested in health and racial equity in some way. And it isn't always in a great way. For example, states where there are anti-CRT legislation or restrictions on teaching divisive concepts in schools, which is related. But really every state is considering something on some level, with the only two exceptions that we have found so far being Wyoming and South Dakota. So you can see the trends on the right-hand side of the slide here, and that at the top of that is treating racism as a public health crisis or emergency. But then also the three I'm going to talk to you about example-wise are early childhood development and education, infrastructure and funding, and healthcare system improvements. But there are other important ones on this list, especially right now. We're seeing a lot of movement around equity in birth outcomes and improving maternal and child and infant health. We are seeing a lot more interest in adopting health or racial equity impact statements or assessments in the legislative process. And then data is heavy, right? How do we better use data, collect data to help make more informed policy decisions that better reflect the needs of the communities that we serve? So here are the examples that I wanted to share. The first is from Vermont in 2021. This particular bill created a health equity advisory commission to promote health equity and eradicate health disparities among Vermonters, including those who are Black, Indigenous, and people of color, people who are LGBTQ, and individuals with disabilities. And the duties of the commission are to provide guidance on the development of the Office of Health Equity and to provide advice and make recommendations to the office once it's established. That was signed into law in May of 2021. The next example is Maine. This particular bill creates a data governance program with the goal of, among other things, creating models for sharing data with the public and for developing policies to reduce disparities and increase equity. And the last example I want to share with you is Connecticut, Senate Bill 476. this bill would have required hospitals to submit community health needs assessments to the Office of Health Strategy, containing, among other things, a description of the health status and health disparities affecting the population within the geographic service area of the hospital, including a representative spectrum of age, racial and ethnic groups, incomes, and medically underserved populations. One of the trends that we're seeing right now across the US is how to better leverage the community benefits spending for nonprofit hospitals, and to make community health needs assessments more meaningful and to execute them in partnership with health departments. So even though this bill failed, I think we absolutely will continue to see some efforts to introduce reforms in this particular space. So I mentioned one of the trends being racism as a public health crisis, and this is actually one of the things I spend most of my time reading about and analyzing. And so what you see here on the left is an image from Alex B. Hill on Twitter, who is GIS director at Wayne State University. This was current through October of 2021. Although we have updates through early this year, but basically it's a map across the US showing where declarations have been issued. Hard red outline is where there is one at the state, and then otherwise it's at the city and county level. And you can see the different kinds of organizations: school boards, universities, governors, mayors, et cetera. More than 245 declarations were issued through 2021 and early 2022. The bulk of those were issued and adopted between April and November of 2020, and this coincided with the racial justice movement of the summer of 2020. And it was also spurred on by, of course, those early months of COVID when we started seeing significant racial and ethnic disparities. There weren't a lot issued through 2021, and only a handful have been issued in 2022 so far. I want to recognize that we have lots of partners in the space who do this work of analyzing racism as a public health crisis. One of those partners is the Institute for Healing, Justice, and Equity at St. Louis University. And they have put out a recent report where they have over 300 declarations that they've identified. And so I think I will share that before we are off this webinar today, but it's a great resource to understand where they are, but more importantly, what kinds of implementation steps are being taken in those communities. So I thought I would share what we know about Minnesota. So there are 6 that I'm aware of and have found, and that is from the House of Representatives. And these are in order by date, earliest to latest: the city of Minneapolis, Hennepin County, Olmsted County, the city of Bloomington, and the city of Red Wing. That was the last one issued, and that was in August of 2021. One of the things that we do, or our partners do, is try to look at these specific communities and say, what's happened since? What's happened since July 17, 2020 or August 10, 2021? What have you accomplished? And so we have a lot of partners who are trying to figure that out, but also help advise communities on the kinds of actions they can take next. One of the ways that we contribute to that conversation is through analysis. And so along with my colleague Betsy Lawton at the Network for Public Health Law, we issued this report here called Racism as a Public Health Crisis: Perspectives on Healthy Aging. And we looked at more than 200 declarations. We looked at state legislative trends during a defined time period, and we looked at COVID-19 Health Equity Task Force reports to figure out how communities and policymakers were taking age across the lifespan and health across the lifespan into account. And this report, importantly, contains a series of recommendations that are aligned with the framework for an age-friendly public health system that was put out by Trust for America's Health. And here's what we found. Point 1, racism affects lifelong health outcomes, even before birth and across every stage of life. That is something that is very clear across all of these declarations. The second is that racism significantly reduces life expectancy, or a measure of how long you can expect to live at birth, which varies by age, gender, race and ethnicity, and geographic location. But also it increases premature mortality, which is commonly measured by years of potential life lost, and this is due to preventable death. And lastly, one of the things that we see commonly referenced in all these declarations is that unequal access to opportunity due to redlining and geographic segregation, discriminatory lending practices, and other discriminatory laws and policies like voter suppression negatively affect economic stability, home ownership, and intergenerational wealth accumulation. So these are very common threads, and I think help to tell the story of why these declarations exist where they are and what the problem is so that we can start to address it. We were very specific in looking at the kind of language and terminology that was used in these declarations. And that's one way of helping us to both recognize the problem and then identify potential solutions. So I know this is hosted by the Office of Diversity, Equity, and Inclusion, and DEI and implicit bias were by far the most common terms in the declarations that we reviewed. So this might be implementing training, or requiring training on implicit bias, incorporating DEI principles into a framework for operations, and related activities, updating policies to reflect DEI values. We also saw lots of references to environmental hazards and climate, as well as, again, premature mortality, death, and life expectancy. But there were other things that we found that were referenced pretty commonly, and that's adverse childhood experiences, or ACEs, and chronic stress and trauma. One interesting finding that, since so many of these were issued early in COVID, when we saw all these disparities by age, not a lot of these declarations have explicit references to age at all, like don't even use the word age. But they do talk about generational trauma and its impacts. And I think that's important for recognizing one of the ways that we can identify how we go forward and heal. So I mentioned that one of the terms, one of the things that I was interested in is voting rights. And so when I was looking at that list of terms a couple slides back, I also looked in declarations for references to voting rights or civic engagement or civic participation. And I found 10 that mention those terms in their declaration, most of them in Michigan. And one of the things to note there is that a lot of communities use template language in drafting their declarations. And so sometimes you'll see the same sentence or the same block in another declaration. That's neither a good or a bad thing. Often having a template helps to move things along, because then people are able to have a base to work from to craft their declaration. At any rate, you'll see similarities in these examples from Michigan that are listed here on the slide. We also have Chattanooga, Tennessee, St. Petersburg, Florida, where I'm from, the New York City Board of Health, Multnomah County, Oregon, and San Diego, California. I do want to read this quote from Chattanooga, because I think it gets at why I'm here talking to you both about racism as a public health crisis and civic engagement. And that is, whereas endemic racial bias within public institutions has been and continues to affect Black Americans, this shows up in all aspects of social society and follows Black Americans into adulthood through the court system via cash bail, longer jail sentences, inadequate venues for voting, purging of voter rolls affecting Black Americans in greater numbers than their white counterparts. We also see examples in St. Petersburg, Florida, where they identify specific efforts by the government to prevent Blacks from voting. And so these are important to call out. This has been a problem of how racism manifests in our laws and policies, and something that we need to do to address those things. This article, I've written about this, called Voting Rights, Why They Should Be Included in Declarations of Racism as a Public Health Crisis. So you may ask yourself, why is a public health lawyer talking about voting anyways? And I like to share, one, I'm just passionate about it. I vote for my ancestors who weren't able to vote, and I vote and I do the work that I do because I want to encourage other people to vote and engage in the process. I like to share this particular article professionally. Voting and civic engagement rights are eroding. What does it mean for health and equity? These are from our partners at County Health Rankings and Roadmaps and the University of Wisconsin Population Health Institute. And I'm really going to read this quote because I think it really captures the reason why I'm talking about voting. As many places in the US have declared racism a public health crisis, the erosion of voting rights must be understood as manifestations of structural and cultural racism, and thus prioritized for action. When democracy is weakened, social cohesion and public health suffer. And I hope to build on that through the rest of the presentation and explain to you the data behind why we know that to be true. But I'm also talking about voting rights and racism as a public health crisis because I arguably think this is a responsibility of us as public health professionals. This is from civic engagement. This is civic engagement in public health accreditation standards. So in domain 4, strengthen, support, and mobilize communities and partnerships, is measure 4.1.3a. Strategy implemented to promote active participation or eliminate barriers to participation among community members. One of the examples they include, which is in bold on this slide on the bottom, is enhancing residents' capacity to understand levers of power or influence in policy change. And arguably, voting is the most important lever of power and influence in policy change. And I think that we have a role as public health professionals and as public health agencies and organizations in helping to increase civic engagement. And I'll explain to you more why. Part of that is built on this literature review that we did, trying to understand what is the relationship between voting and health. And so what we found, I'm happy to share these resources later, but what we have found is that there are a number of health indicators that are associated with civic engagement, commonly measured as voting turnout. The most important of these, arguably, is self-rated health. This is your assessment of your health status relative to other groups or to a different point in time. It's commonly used in health departments as a measure of population health. It's also used in other countries. And in fact, there's a major study across 44 countries, including the US, that showed us that self-rated health is associated with voter turnout. Better self-rated health is associated with voter turnout. But we also know that self-rated mental health and chronic conditions, disability status are all things that also affect voting turnout. And I just want to come back to the idea of self-rated health because it is an overall health and well-being measure in Healthy People 2030 that whether or not a respondent assesses health status as good or better. But this is a list of individual, community health factors and health risk behaviors. So what do we know kind of in a nutshell? That's that health and democracy are interdependent. And so research tells us, number one, based on that list that you just saw, that we know that health and voting are correlated and that they create a reinforcing feedback loop. People who are engaged early in life in the process tend to stay engaged and they tend to have better physical and mental health, which then reinforces their continued participation in the process across their lifespan. But the same thing is true when people are not engaged. They tend to have worse physical and mental health, which reinforces their continued non-participation and effects that can last, again, across the lifespan, going back to thinking about healthy aging. But in both cases, whether on the positive side or the negative side, who is involved in elections influences health policy, power, access, social cohesion. Laws and who gets elected are determined by who shows up. So if you're a healthy voter, I like to use this as an example. If you're a healthy voter and you have money and your life is good, you may not necessarily be going to the polls thinking about the importance of Medicaid expansion in your community. I'm going to talk about Medicaid expansion more toward the end of this. But that's just, it's important to think about, you know, if you have thousands of people who are all really healthy and have things that are going for them that are great, their interests are going to be very different than someone who is experiencing health challenges or financial challenges or transportation challenges, et cetera. So another key resource that I want to share, because this is all going to be tied together in our work on the Health and Democracy Index, is understanding what the cost of voting is in the American states. So I came across this resource as I've been very fortunate to work with Dr. Scott Schroffnagel and his team, who published the Cost of Voting Index. And this was developed by this team at Northern Illinois University and was first published in 2016 as an analysis of the relative cost of voting in presidential election cycles from 1996 to 2016. And the cost of voting refers to the time and effort associated with casting a vote, and it's intended to characterize the overall electoral climate in each state, or the extent to which a state embraces inclusivity in the electoral process versus restriction or exclusion. And what you see here on the graph on the left is states on the left, on the y-axis, and the Covey index values on the x. Oregon's at the top with the best or the lowest cost of voting, and New Hampshire is the worst at the bottom. The components of the cost of voting index basically fall into two buckets that we know affect voting turnout: registering to vote and then casting your ballot. So these are things like registration deadlines and automatic voter registration. And on the other side, voter ID laws and early voting availability. So these are all things that are really important for turnout. And what we did is we want to say, what is the relationship between how easy or hard it is to vote in the states and health, based on our literature that we had been reviewing, based on what we know about the American states. And we created the Health and Democracy Index as part of the Healthy Democracy, Healthy People Coalition as a way to visualize this relationship. And the bottom line is this, that states with more voting access and greater civic participation are healthier. And I'm going to paste this link in the chat. I hope people will take a chance to go check out this website. It's really fun to scroll through. And I love to talk about the process more. But this is important. This is why we talk about voting, because it really does matter for health. And again, 20 days to midterms, it matters for your health. It matters for your individual health and the health of your community. So there are two core components of this index. The first, of course, is the cost of voting index, which is on the x-axis, less access on the left, and more access on the right. And then measures of health status are on the y-axis. And so the default view, which is what you see here, is overall health from America's health rankings, better health at the top and worse health at the bottom. And I hope what you can see here is a very clear, and in my opinion, astonishing trend showing this positive correlation between better voting access and better health. Like, to me, this is astounding. Even more astounding is that this relationship holds up across all 11 measures of health status that we looked at. The other thing that you can do where you can also see how this trend plays out is through our interactive voting policy picker. And this is probably my favorite feature, but basically you can see these 4 categories of policies: inclusive registration, which is automatic same day and election day registration; vote at home, which is all mail or no excuse absentee voting; states that require additional documentation to vote even after you've already established your eligibility to vote; and then states where your rights are not lost or they are restored post-incarceration after a felony conviction. And that's actually the image that you see on the slide here on the left. The states in dark purple in the upper right quadrant do not have restrictive voting rights restoration laws, and they have better health outcomes. Again, I look at this and I love data, but even if you don't really like, data's not your jam, I think you look at this and you say, wow, it's pretty amazing that most of these states that have better laws related to voting rights restoration also have better health outcomes in their communities within their state. And there's a real world impact to that. This is from the Voting Rights Lab on Twitter, and they do a lot of tracking of electoral reforms across the country. This is from Iowa. Governor Reynolds had attempted to work with the legislature to restore voting rights to Iowans and was not successful. So she ended up issuing an executive order. And then of 4,000, this is astounding, 4,000 Iowans who had their voting rights restored after felony convictions and re-registered to vote, 77%, or nearly 4 out of every 5, cast their ballots. This is so significant, and it matters because we know that returning citizens, when they have social supports and they have their rights back and they are engaged in their communities and engaged in democracy, they have better long-term health outcomes and they have lower levels of recidivism. This is, to me, one of the most important interventions, and I actually do a lot of volunteer work in this space. So what affects both voter turnout and health outcomes? This is something ordinarily where I would ask you to use the chat, and you're welcome to actually while I'm talking. If you can think about anything that affects voter turnout and health outcomes, one that we all know is income. People with more money vote at higher rates. People who are making less money, who have lower income levels, vote at lower rates. But what are some other ones that you can think of? And I want you to think about that because these are also things that we know affect health disparities, right? And so what this is a word cloud, and I will read the words, but the things that we know affect both voting turnout and health outcomes, and thus disparities or equity, on the flip side of that, are education, income, language access, availability of services, accessibility of services, proof of identity, proof of insurance, transportation to either polling sites or to a healthcare site. These are all things that we know are important. And I think to keep in mind when we think about the conversation about why are we talking about this relationship between voting and health? This is one of the reasons why some of the same factors are at play. I do want to share that. Oh, and in the chat, we have type of occupation, work schedule. Yes, thank you. That one comes up a lot too, which is, this is why the availability of early voting hours and the timing to be able to access the polls or a healthcare facility is really important, right? This affects your ability to engage. So we have been doing some updated research, and by we, I mean Dr. Schroffnagel, and this is research supported by the Network for Public Health Law. And he's really looking into this research question more deeply because people often ask, how do we know that this is a real relationship that we're seeing in these graphs? So the research question is, when the citizens of a state are more involved in their communities through volunteering, voting, or joining groups, do these individuals and the states they reside in experience better health? And I'm going to show you very high level, but we do have more detailed findings. But the first is this. This is one of the most striking, and that is that there is a strong and statistically significant relationship bivariate relationship between the cost of voting and overall state health. You can see that in the graph here, going back to every presidential election since 1996, this is true, which is really astonishing. So the finding here is that an increase in the cost of voting is associated with a decrease in overall public health. We also find this at the individual level. And so one of the things that Dr. Strafnagel did was look at an individual level analysis using data from the behavioral risk factor surveillance system, and then collapsing individual responses into two categories: those who indicate that their health is good, and those who indicate that their health is bad. And what you see here in this figure is that the relationship between the cost of voting index values and are in these two indicators of individual health. And the finding is that an increase in the cost of voting associates both with higher bad health and also lower good individual health. So this is also just really shores up our finding that we really can say the cost of voting index is a very good indicator of the health status of a particular state following an election. So here are the conclusions from that research. The first is that these strong bivariate relationships withstand great scrutiny, very strongly statistically significant. The second is that a higher cost of voting index value indicates worse state health outcomes and also indicates worse individual health outcomes. And this holds true even when we control for a wide range of variables like political subculture, public health funding, and measures of income and educational attainment. These relationships still hold true. And finally, I didn't show you this here, but one of the findings that will be published later is that the effect of this restrictive state electoral climate on bad health is greater for residents without a college diploma, low-income residents, people over 65, Black Americans, and Hispanic Americans. So when we think about health equity and we think about voting, we know that health outcomes are worse for these populations in states that have more restrictive electoral environments. So I want to tie it all together. I mentioned Medicaid expansion, and I like talking about it, but I want to tie all these concepts together, starting out with policymaking and going into legislation, talking about the health effects and health outcomes and how we know they're related to voting. So here's what we know. Research shows a negative correlation between Medicaid enrollment and voter registration. This affects more people of color, low-income people, people with disabilities, new voters, young voters, and people who move often. The research also shows us that Medicaid expansion can increase voter turnout. We know this from Oregon post-2008. And then Medicaid expansion, we also know, has reduced disparities in coverage and access to care and has increased financial stability for residents in states where it has been expanded. And I put a double arrow because this is where civic engagement comes into play. We know that civic engagement influences all these outcomes that I just walked through, but we also know that all these outcomes influence your ability to participate in the democratic process. And that's through things like voting on ballot initiatives. Medicaid expansion has been passed through ballot initiative in several states, electing leaders who support health reform, and educating and mobilizing voters on the issue. And the end result of that we know from our work on the Health and Democracy Index is both better individual health, simply through just engaging in the democratic process, but also because of better health policy, and then better health, population health, which we know from a lot of studies on Medicaid expansion, but also, again, from participation in our democracy, which we know from our work on the Health and Democracy Index. And I think that's illustrated really well here. If you are not familiar with the Center on Budget and Policy Priorities, they have a lot of great resources on the impacts of Medicaid expansion. There are a lot of great figures. This is one of them, that 19,200 lives were saved in states that expanded Medicaid between 2014 and 2017. That is so significant. 15,600 lives lost in non-expansion states. So this is where health policy matters, and this is where engaging in the democratic process matters. We're talking about literally being able to save lives. So how can you take action? Here's some ballot initiatives and referendums in 2022. And by 2022, I mean 20 days from now in the 2022 midterms. These are all things that are being decided by initiative or referendum in your states. Unfortunately, again, Minnesota does not have, I think I mentioned this earlier, Minnesota does not have a referendum process, but abortion rights, drug policy, criminal justice and policing, healthcare, including Medicaid expansion in South Dakota, transportation, housing, energy and climate, you name it, pretty much it's it's on the ballot. And so this is why it's so important to engage in the elections. And even if you can't vote and you're in a position not to vote, you can help educate other voters. You can help mobilize the people to get out and vote. And remember also, depending on where you are and how engaged your organization is, voting and voter registration are a nonpartisan activity. Everyone should vote. Everyone should vote. Voting impacts all of our health and well-being, and affects us as individuals and affects us as a community. So just getting people engaged in that process is important. But ultimately, all of these things that get decided via these elections will have an impact on health and health equity. And I like these overlapping circles because I think it is all connected. All of these rights, whether or not they are balanced, whether or not they reflect the needs of the communities where they're going to be implemented, really is going to affect health outcomes, and it will improve or exacerbate disparities depending on what gets passed. So I am wrapping up, and then I'm happy to take some questions. But one of the things I wanted to share is a way that you can act is this APHA proposed policy statement. So earlier this year, the American Medical Association issued a resolution recognizing voting as a social determinant of health. Over the past year, and I think it has in fact been a year since we first started drafting this policy statement, I've been working with the Healthy Democracy, Healthy People Coalition as one of the co-authors of Statement C7, Advancing Health Equity Through Protecting and Promoting Access to Voting. So one ask of you, and this is just a screenshot of it on the right of the title page, read the policy statement. You will get a lot more detail about all of the things I've just been talking about. But the other thing is, if you are a member of APHA, and particularly if you're in a section or a caucus or an affiliate like the Public Health Association, please consider supporting this statement. APHA is in a few weeks. We will be having, we have a public hearing on this, and I think in then a week or two, in 2 weeks. And we're really hopeful that this is a policy statement that gets adopted by APHA. You can find it on the policies and advocacy page at the APHA website under proposed policy statements. And I'm happy to also share that link. I want to recognize some of my key partners. I've mentioned Healthy Democracy, Healthy People a couple of times, and I will put them into the chat. They helped really to bring the Health and Democracy Index to life, and also do a lot of organizing, particularly in the public health space. Another important partner is VoteER, an amazing organization that's doing a lot of great work around healthcare-based voter registration and healthcare professionals, getting healthcare professionals, hospitals and health systems involved, and other healthcare spaces. Check them out. They're doing some great work right now too. And then the other organization that I want to mention is the Civic Health Alliance, which is a partnership of organizations. And I'm going to link the Civic Health Compact, which was recently released. I served on an advisory group on this compact, and you can check it out at that link that I just pasted. And this is a lot of recommendations for promoting civic engagement, improving civic health, and importantly, addressing civic health as an upstream, determinant of health outcomes and health equity. Lastly, I want to recognize, to tie in the work that I do around anti-racism and public health, is that over the past year, I've been working with this collaborative for anti-racism and equity, and I've been trying to bring together partners who are working in this space, really trying to help inform the conversation at a national level, helping to provide resources to communities and organizations that are doing anti-racism work, and helping people figure out what to do. Like, how do you implement these things and what do you do next? This is a wide variety of partners: policy, communications, academics, researchers of all kinds. You can see the list here. We're proud to be a part of this collaborative. You can check us out at herenow.org, and I will paste that. We have recently, accidentally opened it instead of copying and pasting it. We have recently updated our website to list some featured resources, so I hope you will check it out. And then lastly, I just want to say thank you, and there will be time for questions. I want to say, number one, vote. Again, midterms coming up. It matters for your individual health and your community health. It can decide key health policy. You saw the things that are being decided through referendums and initiatives this cycle. But I think it's important to note that we all have a stake in improving the lives of children, families, and communities, and that one of the most important ways that we can do that is by voting. So thank you so much for your time, and I look forward to questions. Oh, and there is a question. I'm going to start with I'm going to leave the slides up just for a moment because I think the next question is on a slide. But the first question is there any interest in changing our language from determinants of health to contributors of health? Yes. One thing I think is probably everyone has seen is there are a lot of determinants of health, right? There's the political determinants of health, which is what I'm really largely talking about today. But we also have the social determinants of health. I've seen some publications recently on the commercial determinants of health. And I think having worked in a policy space that often, especially with the phrase social determinants of health, can be a turnoff for policymakers. So yes, I think there is an effort to think about other ways that we can frame factors that influence our health. And I think CDC is putting out a framework, and forgive me, the name is escaping me. It's like vital. It's going to come to me later. But yes, there is an effort to kind of change the language there and think about better ways to engage around these concepts. The second question is slide 13, declarations listed across the US. The map of the US did not seem to include Puerto Rico. Yeah, I will go back to slide 13 if you forgive me for just, oh, you know what? I can scroll through this different way. One of the nice features, I guess, of having a Mac is that I can then scroll through and pick a slide. So this is the slide I think you're talking about. And has Puerto Rico issued a declaration and whether health professionals on the island engage in this work? And if not, are there plans to involve people from Puerto Rico? Thank you. So I have not seen any declarations from Puerto Rico or any of the freely associated states and territories. That does not mean that this work is not going on. And that's true for anywhere in the US where you see like huge white space. Just because there isn't a declaration doesn't mean that there isn't work going on. And frankly, the communities that I think are most successful in terms of their anti-racism efforts are ones where there is a multifaceted, multi-sector effort to engage in this work. So that might mean that you have a health department that already has an office of racial equity, or you have strong community partners and nonprofits and foundations who are pushing forward and funding the work. And so that doesn't mean that not having a declaration is indicative of no work going on, but it can also be. So I'd be happy to follow up more specifically and see if there's more information on Puerto Rico, but to my knowledge, no declaration there or in any of the other territories. And I will stop share and look for more questions or comments. While you're thinking, I will talk about St. Petersburg, Florida. So we did a webinar at the network in March of this year with our partner, one of our partners, Salute America, which you saw as a partner in the Collaborative for Anti-Racism and Equity, talking about how do you really get these declarations passed. And I think this kind of builds on the question that Annette put in the chat. And so we had really great deal of success in partners working with local elected officials in the city of St. Petersburg to get this passed. But the city of St. Petersburg tends to be, I think, a little bit more progressive than other parts of the county. So it sits in Pinellas County, Florida, which the northern part of the county tends to be more white and more affluent and more conservative. And it has been much more difficult for local groups to get the county commission to also issue a declaration. And it's something that they're continuing to work on and educate partners and educate our local elected officials. But it's certainly a challenge in communities where there's a little bit more resistance to these concepts. That's not to say it can't be done. We do have 2 counties in Florida, Hillsborough County, Florida, and Manatee County, Florida, that have issued declarations. And these are largely spearheaded by community groups who are really trying to engage and mobilize people in the community to talk to their elected officials about this work and how to implement it. Yes. So how can we advocate for disenfranchised Black voters being arrested in Florida right now? So one thing I will say is that if you're in Florida, or even if you're not, Florida Rights Restoration Coalition is mobilizing volunteer attorneys throughout the state who are helping to take on some of these cases. So if you are an attorney and you're in a position to volunteer and do pro bono work and you're licensed in Florida, do that. If you're not, and you otherwise want to support, you can look at ways that you can support organizations like the Florida Rights Restoration Coalition that is doing this work. The other thing that I think we can all do is help to draw attention to the issue. I think the more people know that this is happening and the injustice that is happening, and we bring attention to it, we can also help to share solutions to that. So part of it is just educating people on the law that these folks are being arrested under, their potential legal solutions, and then the financial support that they kind of need to help get through this process. So, I think there are lots of ways to engage in advocacy. And, the very least each of us can do is bring attention to this issue and to share it with friends and family members and partners and coworkers. And you never know who you might reach with that information. There might be somebody who can actually actively help one of these individuals. But yes, there are organizations here on the ground that are helping to work with those individuals. Yeah, there was just an article today about it. That might be the one. Thank you, Lauren, for that question and for posting that. Yes, so the question is, thank you. It says, thank you for this presentation, Christina. So much rich information and state level tracking. Are you also monitoring the specific agencies and states that are making these declarations? Yes, so we actually do know the different kinds of declarations across school boards, boards of health, county commissions, medical and health associations, you name it. We are tracking it. We're actually in the process of putting together a resource that that groups all of the declarations by type. So if you were interested in counties, you could go to counties, or if you're interested in associations and organizations, you could go to that easily and find that information. So we do have all of that. And really, I think that's actually where most of the work is happening, is not at the state level, but really at the local level. And that hopefully will be released soon. We're working on it now. It takes a lot. There are over 300 now. And so we are doing our due diligence to make sure that the resource is accurate and before we put it out. But that will become available on our herenow.org website. Yes, and if you're interested in Medicaid, one of the things to look into is Medicaid-based automatic voter registration. So there are probably 6 or 7 states that can do this. I think Colorado is the only one that's actually actively implementing it, maybe one more state. The reason that it's important is that, one, I mentioned to you about how Medicaid enrollees are least likely to be voters, active voters or registered voters, but there is an effort to look at how to incorporate voter registration in Medicaid agencies, because the process to get approved for Medicaid goes through all of the things that you need to prove to be a voter as well, right? So you can incorporate those in the same process. You have proof of identity, et cetera, in a very standard process. It's one way to do it. And so there is, I think, going to be an increasing interest in that, in Medicaid-based automatic voter registration, but also through other state agencies. Actually, Minnesota is great because Minnesota is the only state that has a law that requires support for voter registration activities in all state agencies. And I believe also agencies receiving state funding, but I have to look at the law to be sure. But it's the only state to have a law like that. I guess, Christina, I should answer more specifically. I'm not aware of any Medicaid agencies that have issued a declaration specifically, but I do think Medicaid's involvement in advancing civic participation and health equity is important. And then Centers for Medicare and Medicaid Services have, of course, put out guidelines for how to integrate health equity throughout the system. And I think that will trickle down to kind of the work that happens at the states. And so we hope to see more of that work advanced through Medicaid agencies.
Well, since the questions slowed down, we can start to wrap up. Dawn, I really want to thank you for engaging with our community today. Oh, there's one more question. Do you want to answer that one? Give me a second.
Yeah, let me see if I can go back. So the question is, do I know why the bill in Connecticut failed? I do not know specifically why. I do know that community benefits program, I mentioned that there's a trend in wanting to make changes to how these programs operate, and they have reporting requirements, of course, to IRS, but often it becomes just a reporting process and checking a box and not really meaningful investment of dollars into the community. And so I think there is often resistance to changing the process and greater accountability. I'm sure that was a factor there, although I wasn't on the ground when that bill was being debated. Would be happy to look into it more and see what I could find out. I think the lessons learned in places like Vermont and Maine for why they're successful is being very clear, especially like on the data law in Maine, being very clear on how it can advance, how those bills can help to advance better health outcomes from the state or improve conditions in the state. I think one thing that's appealing to all legislators is, one, how to improve the state's financial condition, two, how to have better overall health in the state, and three, to just make it kind of a state that's appealing to live in, right? You can be healthy here, you can be successful here. And so passing legislation that helps to create those conditions is one way to do that. Again, I wasn't on the ground for any of these bills, but happy to look into it more offline if you'd be interested. I'm always interested in why things don't pass. And I will share a short story. I worked on a bill to update the Public Health Act in New Mexico, and we introduced it first in 2015. And it was actually a very non-controversial bill that moved through most of the process and then ultimately failed. And not because of anything that was wrong with the bill. There were a lot of, as most legislatures, there was a lot of political work going on behind the scenes that prevented it from going forward. But we reintroduced it in 2017. The climate was different, the relationships were different, and the bill successfully passed and was signed into law. So that's also just part of the legislative process, is that sometimes the politics prevent things from going forward. But you can expect to see them introduced, and often in states that I've looked at, you can sometimes have 10% or less of the bills introduced actually become law.
Thank you for answering that last one. Don, in the chat, can you put the best way for folks to contact you? I do appreciate everyone who came again and for engaging with our content and our strategic plan for anti-racism. We do have an upcoming event, as is mentioned in the chat. We'll be talking about transgender justice. So thank you all. Please remember to fill out the evaluation, and we will let you know about any other upcoming events on our webpage. Have a great day. Thank you again, Dawn.
Thank you for having me. Appreciate the opportunity to be here today.
Of course. Take care, everyone.